everyone. We are here with another We Go There video blog series with our specialist pelvic floor physiotherapist, Kate Roddy. Also, full-on mom boss entrepreneur, has just developed the Kegel Release Curve, which we're going to talk all about. I'm so excited. I personally am such an advocate for pelvic floor therapy. So this is my second baby. I have Piper, 18-month-old Piper at home, and I really attribute my laboring experience to pelvic floor therapy. I talk about it all the time. And so I think today it's really important for us to talk about, like, why is it important? How does it impact your pregnancy, laboring experience, postpartum, but also, like, in general, who should be doing pelvic floor therapy, and I guess the benefits of it. And then we're gonna get right into this Kegel Release Curve because I'm super into it, and I'm 35 weeks and I have to start using it like today. So we're not gonna do that on video.
No, not on camera. Perfect.
Okay, so tell me about pelvic floor physiotherapy and just like the benefits and things that, you know, it helps with pregnancy and laboring.
Yeah, so pelvic floor physio is basically as it relates to any muscles in our pelvic area, right? So in our vaginas, that is the internal part, and that's basically made up of muscles. And so with different life events, one being pregnancy, those pelvic floor muscles can go through, as beautiful as birth is, trauma. So we want to sort of make sure that those muscles recover just like we would any other body part that's been injured, right? So if you had a knee replacement or a knee surgery, you would probably want to strengthen the muscles around it before, and then afterwards you're going to let it rest, and then you're going to start to re-strengthen it because surgery changed how your body wants to respond. Okay, so definitely for our pre-population or prenatal population is get in to see your pelvic floor therapist to see, do you even know how to use your pelvic floor? That's a big mystery for some women. Other women, they're very surprised to learn that they're really strong. And that's great. That's reassuring. But it's good to have that initial check. It's good to see us to give you even like other advice on going through your pregnancy, aches and pains and what you're about to go through. And then we do, at around that 35-week mark, we start to prescribe that women start to do perineal massage, which is basically starting to stretch out those muscles and prepare the area for a baby's beautiful head, massive head to come through. And then of course all of the stuff postpartum after is the recovery, right?
Which is so important.
Rehabilitate. This is where women do start to exhibit symptoms or of incontinence, which is the accidental leaks when we sneeze, when we laugh, or maybe
all the time.
Or we're feeling like you have to pee every 20 minutes. And then even the like topic that people don't want to talk about is that
which
first,
we do talk about on
we talk about we're going to is the sex, right? That first sexual encounter,
terrifying
it's terrifying, and that fear leads into some of our tension, which being able to even like prepare your perineum for sex after is a great idea, so that the first time isn't painful, and if the first time's painful, we anticipate the second time being painful, and then we start nodding. We start nodding like we should never not want to have sex. But it starts to happen when every single time is painful. So
absolutely. So literally everything around before, middle, after is around that has to do with the muscles in your pelvic floor. And I think it's so like, it's like an athlete, right? Like training before, you're having this laboring experience that is so intense on your body, and then the post recovery and the importance of that. So I want to talk about and prepare people because everyone should go and see their pelvic floor therapist, and when they do that first time, because I was just told by my midwife you should go see a pelvic floor therapist, and I went. And my husband texts me like after the appointment, or probably during, like, so how was it? And I wrote him, and all I said is, Well, I laid there while envisioning a flower blooming out of my vagina as my physiotherapist's hands were inside me.
Yes.
And
Yes.
that was my first experience. And I had no idea what to expect.
Yeah.
So I think it's good for people to kind of understand that first appointment.
Sure. So yes, okay, so physios, we deal with muscles all throughout the body.
Yeah.
And then if you are a pelvic floor therapist, you've gone through extra certifications to do internal assessments.
Right.
So we are qualified, and it is within our scope of practice to do an internal assessment, much like an OBGYN or a
Right.
midwife would. So the only way we can get a true sense of what your pelvic floor is doing is if we feel it.
Makes sense.
Like the parallel is I would never assess your knee through a pair of jeans.
Right.
Right?
Right.
I would get you to put on a pair of shorts.
Yes.
So similarly, our pelvic floor, we are looking at whether or not you can contract those muscles and whether or not you can relax muscles, because muscle dysfunction is both sides of the coin.
Yeah.
If all you do is sit and you tense up and that's all you know how to do, the relaxation doesn't happen.
Right.
And so I want to make sure that you know how to just like chill out down there,
Yes.
as much as give me a strong contraction when you sneeze or when you cough.
And I think that was such an eye-opening experience for me, because I feel like our adult life, we're just told to Kegel, 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 and everyone's like, are you Kegling every day? And are you Kegling this many times a day? And on my girlfriend group chats, like there's chatter around Kegels, but no one tells you. Then when I went in for my appointment, she was like, do not Kegel again, just start to relax, and gave me the techniques to be able to breathe through that tension, as well as some tools around it.
Yeah.
So let's talk about Kegeling, and then this is obviously where your amazing Kegel Release Curve comes in.
Yeah.
So I think maybe start like, what's a Kegel, and then what is kind of the, I guess, people who have the tension and probably equally as much as people who need a Kegel?
Yeah,
I'd assume.
absolutely.
Okay.
So a Kegel is after Dr. Arnold Kegel.
Oh,
so of
no
course,
way.
a male doctor named a pelvic floor contraction.
Of course.
So a Kegel is your pelvic muscles actually contracting, okay? And they have two different functions, a couple of functions, but the ones to focus on right now is those muscles are sphincteric, which just means they hug and close, okay? But they also provide lift, which is what supports our pelvic organs.
Right.
So contracting those muscles, we gotta have a hug and we gotta have a lift for them to be really effective.
Right.
And so Dr. Arnold Kegel started presenting all of this information in the 40s that if you just contract those muscles, they were seeing improvements with incontinence. Right. So that's where it became just do your Kegels. And really that's where it all stopped and continued in the medical profession. So you will still have OBGYNs and doctors and even sometimes midwives to this day saying, you need to Kegel.
Right.
You need to Kegel.
And people relating, like I thought, oh well, I'm pregnant, I'm sneezing and peeing, like I must need to Kegel, but it's still the same symptoms, which is really surprising to me.
You're right. So the thing to think about is when you have a knee surgery, your quadricep muscle and all the muscles around your knee gets really, really tight because it's guarding and protecting that area while it's healing.
Right.
So you think about having birth, those muscles kind of just went through the ringer.
Yes.
And if anything, they get really tight and they get really tense because pain is also associated. So when you even think about like your neck having a crick in it, everything gets tight, right? So us telling the general population of women to keep Kegeling, you're just getting
continuing to tighten.
Right.
Yeah.
And then those pelvic muscles, which surround your bladder as well, those are pressing on your bladder.
Right.
So then you start to get the sense of, no wonder I have to pee all the time. Those muscles are not letting go of your bladder. So,
so you have the release.
I have the Kegel Release Curve because I realize that most women are too tight. The other thing that we prescribe is the perineal massage, which we want to prep women for. But I had an 11.
Yeah, I couldn't believe when I read this on your bio.
So my first child was 11 pounds, 5 ounces.
Like, good on you, girl.
Thoughts and prayers for my vagina.
Please don't be 11 pounds.
Yeah, please don't be 11. And the thing is I had read about perineal massage and I honestly could barely wipe.
Right.
Like it was just a far travel. And the next thing they tell you to do is like have your partner do it.
Right. Of course.
So
I'm sure he wanted to get right in there.
I wouldn't trust like my husband to massage my shoulders, let alone going down there.
Yeah.
And so I just remember thinking like, I'd love to do that if it was easier, but I didn't. So that's sort of where the idea came from.
Yeah.
And then we started research over a year ago, and then we've created
amazing
the Kegel Release Curve.
Okay, so can you tell us all about the Kegel Release Curve?
Sure.
And how it can prepare like your perineum and just the experience of the ring of fire, basically, that you're going to experience when you push the baby out.
Okay, the ring of fire. Perfect. Let's start there.
As they call it.
Which
would be, I'd say, accurate.
So the Kegel Release Curve is basically a pelvic wand. There are pelvic wands on the market. The reason why this one is a little bit different is that this one is made out of surgical grade stainless steel, okay?
Yeah.
So the real benefit of the material that we chose is that you can warm it up.
Oh.
And when you can warm it up, it's just a little bit more relaxing.
More effective,
right? Yeah. Whenever we have a massage, your massage therapist puts a heat pack on your back and just warms the area. Right. So same with this. Metal can be very cold. You don't, you don't want that in there right now.
Do you need me to be a shape of a vagina for you? I know you've used this
if
before.
you can be my vagina wing girl. So tip it down, other way. Yeah, beautiful. Okay, so imagine this is the entrance of your vagina.
Yeah.
Okay. So we've got 12 o'clock. 12 o'clock is where your urethra is, which is where you pee.
Got it.
Okay. And it's down here. This is all the area that stretches. Okay. So what you would do is, if I was your arm, I would come in down from the bottom.
Yeah.
You can use whatever type of lubricant you want.
We recommend South Sex H2O.
Perfect. Okay. So you're going to use an abundance of that, okay? And you're going to guide this in right down at the bottom.
Yeah.
And then you're just using the handle for a little bit of leverage.
And how much tension?
So that's up to you,
okay.
right? Because you're really preparing that pelvic floor, and the first time you don't want to go all out. You just want to sort of familiarize yourself with where's this feeling a little bit more tense or maybe discomfort for you, and that's the areas that you want to work. So the first session, you may just do 2 or 3 minutes, and you're just trying to suss out, okay, this side feels a little bit tighter, or people would associate that with a bit more pain, right?
Okay.
But the idea is that these are just muscles. So imagine someone stretching your calf or your quad. What would that stretch feel like? And could you just hold it a little bit longer, breathe through, promote some of that relaxation, and then take it a little bit further? Right?
And so being able to stretch these muscles can help prevent like tearing, and
that is the goal. Yeah. Every woman who's going to have birth has some risk. We don't know what it is for each person, but there's some risk of possibly needing an episiotomy, which is where they actually cut the muscles purposefully to avoid major tears, or some other schools of thought is just to let everything happen naturally and see how it goes. So either way, you want to mitigate that risk and prepare that tissue for what a stretch feels like. But if you feel like it's hurting a lot, you're going to tense up. That's automatically what the body's going to do. Yeah, that's automatically what the body will do with pain. So if you already know how that feels because you've been preparing, then you can kind of work through that and go, okay, I know what this feels like. I'm going to breathe through the next 30 seconds. And then that allows those muscles to just automatically release, which is really where we want to pass the child through.
It makes so much sense. Like less tense you are during your laboring experience, the less tense then that muscle is, and you can hopefully deliver it a little less painfully.
Exactly.
That's awesome.
So it's double-ended, okay? So most people, if you were just using this for general everyday stress, because we hold a lot of stress in our pelvic floor that we don't know about.
I'm sure that's why I was considered tight.
So really the one end is usually going to do the trick, but as you are preparing for birth, you can flip this around and use the wider end. And then that's really all for the pre stuff, okay? So you might start 2 to 5 minutes, but like most women don't push the baby out within 2 minutes. No. So you want to
God,
work
I
up.
wish.
Yeah, you want to work up to like 15 minutes. You don't need to spend an hour doing this.
Yeah.
But you do want to sort of like keep adding pressure, keep adding tension, so that you know you're good to go day of.
Amazing.
Right? And then the other cool use that we have told women to do is, so the first 6 weeks after, okay, is healing time. It is rest. It is allowing those tissues to just recover from what they did.
Right.
So OBGYNs, your birth provider is going to say, you don't put anything in there.
Right.
Okay, because we have an open wound, basically.
Right.
So we want to let that heal. But as soon as you get clearance from your birth provider, you can have this in the fridge, or you can put it under cold water, and you can insert it, and it becomes an internal cold pack, which can be really soothing to your lady bits.
And healing.
Yeah, and healing. And sometimes you're just then trying to promote gentle pull, like gentle, because at 6 weeks, the doctors are kind of like, you can have sex.
Right. Yeah.
Just go right back to it.
Let's go.
Right. You feel like it, right?
Totally.
Yeah. So you kind of like, you're going to just do it on your own, so that, again, that first sexual experience after labor is not.
That's
right?
amazing. So it prepares you before labor and then after, before getting back on the horse. Literally. And you're good to go, basically.
Yeah, exactly.
But that's so, it's, I mean, very impressive. I'm going to start using it.
Amazing.
I will report back.
Yeah, because you use the Epino.
I used the Epino, which basically is like a balloon that, like, I'm not kidding, I'd lie next to Adam in bed at night and be like, okay, and I'd blow this little balloon up inside my vagina that would help to just expand the perineum. Yeah. I did it. Yeah.
Yeah.
And I actually didn't tear with Piper.
Amazing.
So we'll see this time around, but I'm going to use this.
Yeah, amazing.
Because they no longer offer the Epino, like you can't buy it in Canada.
You can't buy it on the Canada, so.
The Curve is the way to go.
Yeah.
Thank you, Kate. This has been so informative.
Thank you.
I love it. And again, see a pelvic floor therapist. I can't explain how much of a difference any friends I've sent to one have really been, they've had, an amazing, a better labor experience probably than they would have had without one. Yeah. Let's just say that.
Perfect.
But thank you so much for coming in, send any questions to us. Also check out Kate's blog that she wrote, Is Your Vagina Living Its Best Life? Wouldn't you like to know? And Kate also on her Kegel Release Curve website has a quiz that you can take, which is amazing to see if your vagina is living its best life. So check it out.
Awesome. Thank you.
Thank you.